to all of you. Today we will discuss about the fetal growth and development of the first month or 4 weeks. Fertilization. The sperm fertilizes the egg and forming the zygote. Cleavage. The cleavage undergoes several cell division forming the morula. Morula goes to several cell division and called blastocyte. Implantation. The blastocyte implant in the uterine lining. Then gastrulation. The embryo undergo the gastrulation forming the three germ cell layer, that is the ectoderm, endoderm and mesoderm. Organogenesis, formation of the organ. The foundation of the major organ and body system is laid down. Heart formation. The heart is begun to form the beat around 3 to 4 weeks. Neural tube formation. The neural tube which will form the brain and the spinal cord began to develop. Basic body structure. The embryo basic body structure including the head, tail and limbs buds start to take place. End of the month, the eye embryo's size will be 5 to 6 milliliter in length. Sensory development. Vision, eye are forming but eyelid are fused and shut. Hearing, the ear are developed but it's unclear. The fetus cannot detect the sound. Motor skill. Movement. The fetus is active moving its limbs, body and but these movements not detected by mothers. Brain development and nervous system development. Brain. The brain developing rapidly and nerve cell multiply. Nervous system. The nervous system is starting functioning and fetus can respond to stimuli. In second month, physical development, the size of the fetus will be 2 inch to 2.5 and 5 centimeter in length. Organ function, most major organ body system are forming. Limbs, arm and legs are developing with the small buds visible. Organ development, heart is pumping blood throughout its chamber. Brain, the brain is dividing into different sections. Digestive still forming. It is not formed completely but still forming. Sensory development, eye, the eye are forming but eyelid are fused and shut. Ear are developing. Fetus can detect touch and movement. Other development, neural tube, the neural tube is closing which will be eventually form the brain and spinal cord. The other the blood vessel are developing. In third month, physical development, the size of the fetus will be to 1.22 and 2.5 centimeter to 3 centimeters 2 inches or 5.5 and 7.5 centimeter in length, and weight is around 0.25 to 0.5 ounces or 7 to 14 grams. Organ function, most major organs such as the heart, lungs and liver, kidney are formed and functioning. Limbs, the arm and the legs developed and finger and toes are functioning. Physical feature. Face is taking shape with eyes, nose, mouth and ear are visible. Wing and kick will be started in third month. Sensory development. The eyes are forming but eyelids are fused and shut. Hearing, ear are developed and fetus can detect sound outside the womb. Touch. Fetus can detect the touch and movement. Motor skill. Fetus move active, moving its limbs and birds and the reflexes. The fetus can swallow, kick and even suck, and sucking and swallowing reflex will be present. In fourth month, the size of the fetus measurement approximately 6 to 8 inch, 15 to 20 centimeter in length, weights around 6 to 8 ounces and 170 to 2 to 5 grams. Organ development, major organs such as the heart, lungs and liver, kidney are functioning and maturing. Skin and fatty layer, the skin is starting thicken and the fat layers are forming. Hair and nails. The hair lanugos is growing on the body and the fingernails and the toenails are developing. Sensory development. Vision, eyes are forming and fetus can detect the light. Hearing are developed and fetus can detect the sound outside the womb. Taste and smell. Fetus can detect the different taste and smell. Motor development. Fetus moving its limbs, kicking and even sucking its thumb. Reflexes, swallowing, kicking and responses to stimuli. Brain and nervous system. Brain development. Brain is developing rapidly and cell is multiplying. Nervous system. The nervous system is maturing and fetus can um, respond to stimuli. Your baby is covered with a layer of thick drawn hair called lanugo. Heartbeat can be heard clearly. This is you feel your baby's kick. In fifth month physical development, the size length will be 10 to 12 inches and 25 to 30 centimeter. Weight is around 1.1 and 1.5 pounds and 0.5 to 0.7 kg. Skin and fatty layer. The skin is thickening and the fat layers are increasing. Hair and nails. The hair's lanugo is covered. The body, fingers, nails and toenails are developed. Muscle development. The muscle becomes strong, allowing for the more complex movement. Sensory development. Hearing, the fetus can detect and respond to this outside of the stimuli of outside the womb. Vision can detect touch and movement. Eyebrow and eyelid are visible. Touch, fetus can detect touch and movement. Movement, active movement, moving limbs, kicking, even responding to stimuli. Swallowing and sucking motion is present. Brain and nervous system. Brain is maturing and nerve cells are multiplying. Sleep cycle is developed now. Physical development of the 6 month. Skin and the fatty layers. The skin is reddish, wrinkled and transparent with the visible veins. Fingerprints and the toe prints are well developed. The hair grow continuously on the head and the body with lanugo covering the shoulder and back. The skin is protected by barnic sciosa. Sensory development. Eye begin to part and and can open them. Fetus can respond to sound, light, and touch. Hearing is fully developed. Motor skill. Active to move and respond to stimuli. Reflexes are more coordinated, allowing the fetus to blink, grasp, and turn its head. Organ development. The lungs are maturing, preparing for the life outside the womb. GI system is functioning with fetus swallowing and urinating the amniotic fluid. The CNS system developing quickly. Other development. The fetus has a sleep awake cycle, can be active or sleep. The pancreas starting producing the digestive enzyme. Fetus become more active. Mothers can feel the kick and scream. Growth and development of the 7th month. Fetus length is 20 centimeter. Weight is around 1100 gram. Limbs are well flexed. Brain developing rapidly. Eyelids are open and closed. Lungs developed sufficiently to provide gas exchange. Lactation forming. If born unit can breathe at this time. In 8 month, length of the fetus is 31 centimeter. Weight is around 1800 gram. Limbs are well flexed. Bones are fully developed. Subcutaneous fat has collected and lactation to sphingomyelin ratio is uh, 1 and 2.1. Fetal growth development of the 9 month. Fetus length is 35 centimeter. Weight is around 2200 to 2900 grams. Skin pink and body is round. Skin is less wrinkled. Lanugo is disappearing. Brain development rapidly. Eyes are open and closed. Lungs are developed sufficiently provide gas exchange. If born unit can breathe at this time. Physical development length is 45 to 55 centimeter. Weight is around 2 to 2.5 to 4 kg. Skin is less wrinkled. Fat layers are well developed to regulate body temperature. Fingernails and toenails are fully formed. Organ development, lungs, heart, brains, and CNS, GI is fully formed and function adequately. Sensory development, eye can open and close. The fetus can respond to light and detect sound. Fetus can respond to auditory stimuli. Motor skill can move its limbs, thumb and swallowing muscles are well developed, allowing to move coordinating movement. Preparation for the birth. Fetus is positioned head down in the birth canal for the delivery. Bones are hardening except the skull bone which remains soft. Thank you very much for listening.